It is so wonderful to see so many of you here tonight with more to come. So many friends, old and new. Thank you for attending what I believe is our most important salon ever. And for those of you who don't know, I've been putting on these in person for over 12 years in our offices over champagne, and now during the pandemic over Zoom, to bring wonderful, smart, accomplished, activists, and nice people together to discuss issues of consequence. So this is the issue of our lifetime: the march of science to conquer the worldwide devastation of a pandemic. Never have we been so able to innovate so quickly so as to develop vaccines and bring them to market in less than a year. For all the global missteps in handling this scourge, this is a giant, giant win. A miracle, really. Yet vaccine hesitancy is real. And with so many reasons, and with good reason in so many communities. There are so many terrific campaigns out there like Vaccinate4Love, and we hope to partner with them and you, and so many other organizations to help amplify one another's voice and get the word out. But Vaccine4Love's one contribution beyond the endorsement of 1,200 of America's top doctors, some of which are joining this call as well, is that this campaign speaks from the head and the heart, to the head and the heart of our listeners. After all, scientific evidence is overwhelming, but that's not always what persuades us to action. What does? Something that is spoken of relatively infrequently in this context: love. Love of family, friends, community, self, and the world. Love, this is what moves mountains. And this is what our campaign, so brilliantly created by Victor DeCastro, focuses on. We've experienced a terrible physical and emotional toll over this past year, and trust has been weakened in so very, very many ways. Now we have an emerging way out. Science has given us this gift, but it's love that will help us accept it. So that's what we're hoping that our campaign can highlight. And speaking of which, speaking of love, I would like to thank the amazing team that has donated its efforts to creating this campaign. Now, Dr. Jacqueline Jones, we're going to talk to her in a minute. And she, above the rest, is the person who came up with this idea, whose brainchild this entire idea is. And then once she asked me to help in any way I could, I brought in creative director Victor DeCastro, brand strategist Roger Kioki, and the entire Temin team. Trang Mar, our managing director and head of client engagement, who you see, she's the voice of God throughout this entire event. And let me tell you, knowing her, you better pay attention to her. Amy Cow, our director, who is staffing the trouble hotline. So if there's any trouble, I'll tell you this a little bit later. If you have any technical trouble whatsoever, she's the person to call or email or text, and she is on the job. Suzanne Oakes Brownstein, a managing director here at Temin & Company, writer. Maria Matviva, our tireless marketing and executive assistant. And Rachel Clark, our COO, who can't be here today, but is here in spirit, we know. It's a true dream team. So today we're here to launch this public awareness campaign and tell you the story behind it. The brainchild of Dr. Jacqueline Jones, our featured guest, and it is gathering momentum and strategic partners every minute. We're going to ask you to help us by helping the campaign go viral in the right kind of virality. And by thinking of how you can partner with us to follow us, like us, post and repost on social media with all your groups and all your contacts. To help us place public service ads in your magazines and newspapers and online publications, and our PSAs, which are quite wonderful, on your networks and channels. To physically put our posters in your bank branches and offices, even to help us connect with billboard companies who could help us put the message out on billboards as a public service. By donating to support our efforts, and so much more, we don't even know what it is yet. So let me tell you a little bit about Dr. Jackie Jones, beyond the fact that she knows absolutely everybody. Jackie is an associate professor of clinical, yeah, Jackie, you get to
otolaryngology.
Say that 5 times fast. All right, ear, nose, and throat at Weill Cornell Medical Center. She graduated from Smith College, completed her residency at the University of Pennsylvania, and her fellowship at Harvard University. She is one of America's top doctors, and she sits on the medical advisory board of Castle Connolly Top Doctors. She has been my doctor and friend for well over 15 years. And let me tell you, she is a true force of nature, and you're going to see that. So before I turn to Jackie, let me just do some housekeeping. If there's a technical glitch, hang in there, we'll recover. We have Amy standing by on the phone and email in case you have any issues. Her phone number is 917-605-2618. We're going to post this in the chat. And her email is at salon@teminandco.com. Again, it'll be posted in the chat in case you have any problems. We are recording this webinar, and a recorded version will be available on our website and the Vaccinate4Love.org website afterwards. There will be an opportunity to engage with one another during the Q&A portion of the program. And in that, what we do is, if you post that you have a question in chat, Trang will call on you, she'll unmute you, and then you can give your question yourself, not have somebody else read it for you. And if any point you have any questions, just put that in the chat too. And then afterwards, if you want to hang around after the formal proceedings are done, we can't have a lot of champagne and tea sandwiches like we usually do, or some people, Ray, have been known to stay till 1 o'clock afterwards. We will be able to stay on and chat amongst ourselves if you'd like. So you be the judge of what you'd like to do. Okay, so what we're going to do now is Jackie and I are going to have a chat, and then we're going to bring in Victor and Roger and have a few questions for them, and then we'll open it up to Q&A. Okay? So, Jackie, the force of nature. Can you tell us a little bit the story behind this and how you came about thinking about it?
Well, David, thank you so much for introducing me. I have to say, I'm really overwhelmed by the support and turnout for our initiative. And the message that I really hope to reiterate throughout our discussion tonight is the message that we can't come through this pandemic without collaboration, cooperation, and supporting each other to reach those goals. Of note, I mean, David called me a force of nature, but she's a force to be reckoned with as well. And I really have to thank her for taking my idea and helping me to form this initiative. We're joined by Victor DeCastro and Roger Kioki, our creative team, who've just done amazing work. And all these people have been donating their time and skills. And I cannot tell you how appreciative I am of their efforts. I'd also like to thank Castle and Connolly for their vision in allowing me to pursue this project. We have several strategic partners who are on our call tonight, and we thank you so much for joining us. But I'd like to acknowledge Andrew Bluestein and the lawyers of Garfunkel Weil for their guidance and pro bono work to launch this initiative, and for Tammy McKinney from Plan Heal for introducing us to innovative technologies to broadcast our message. So thank you so much for all those people who have donated all their time. Well, you know, it's been a really tough year for all of us. We've worried about our family and our friends, as well as our own health. And as a physician, we carry those worries as well as our concern for our patients' health and how we can shepherd our patients through this really, really difficult time. So many people have mourned the loss of friends and even loved ones, which has been devastating on so many levels. But each and every one of us has suffered those multitudes of small losses, from missed time with family and friends to delayed vacations and family celebrations. Personally, I shall never forget the sadness in my son's eyes as he graduated from college last May in our living room with only his parents to share this milestone in his life. So in late December, when I was offered as an ENT doctor the opportunity to get the COVID vaccine, I was on it. I was there within an hour, and I was so happy to get it. So 2 weeks later, I was in the operating room, and those of you who know me, I'm sort of one of those chatty people, and I'm talking about my life and everything that's going on. And I mentioned how happy I was and how excited I was to receive the vaccine. And one of the young nurses turned to me and said, "I'm not getting that vaccine. I don't want anyone experimenting on me." I'm like, okay, she's just young. But one of the more seasoned nurses looked at me and said, there's going to be side effects. This is a new vaccine. I'm not doing it either. I'm going to wait till next year. I'm like, really? And then what really shocked me was one of my dear friends who was an anesthesiologist with over 40 years experience. She turned to me and said, "I'm afraid to. I'm just not getting it." And I was like, really? So at lunchtime, I went to the break room and I surveyed the doctors, the nurses, and all the technicians to see what people were really thinking in the medical community. And over a third of them were not going to get the vaccine. I was absolutely dumbfounded. So I said, I got to do something. So I took my concerns to my friends at Castle and Conley Top Doctors. And Castle and Conley is an organization to all those top physicians in the United States and asked them to support a statement promoting the vaccine's safety and efficacy. And over 1,200 of them signed that statement. So now I've got the statement. How am I going to get it out? And that's where Davia comes in. I turned to her and said, "This is so important. Can you help me?" Davia, it was done. So that's how Vaccinate4Love was formed. And again, I am so appreciative for each and every one of you for taking the time out of your busy lives to join us and get involved. So thank you.
Thank you, Jackie. So as you think about it, what do you think the progression of this disease is going to be? I mean, we're coming into a limbo state now. Some people are vaccinated, some people aren't. Some people want it very much, can't get it. Other people who could get it don't want it. How do you think this is going to progress, and how can we turn the tide, help to turn the tide?
Well, this is such an important initiative. I've been a physician for 31 years, and oh my goodness, I never have seen anything like this. None of us have, and I hope to never see it again in my lifetime. But together, we really do have to stem the tide. And it has been really devastating for everyone on so many different levels. And now that the variants are showing up, we really do need to get everybody vaccinated because they seem to be spreading more quickly and are maybe a little bit more virulent. So if you think of the coronavirus like sort of like the flu, and the reason why the flu the flu vaccine is so ineffective, all of us are like, okay, I'm going to get it, but I still might get the flu, is because there's so many variations of it. Each year, there's 15 to 16 variations of the flu. Well, there's really only maybe 6 or 7 variations of the SARS virus, the coronavirus. So we really feel that the vaccines that are out there are going to be effective, even if one is infected with one of these variants. You may get sick, but it's going to be mild, like getting the flu. You're not going to end up in the hospital, or God forbid, even worse, not get out of the hospital. So what we need to do is we need to get everybody vaccinated. If we're all vaccinated, we can reach that sort of herd immunity, but really can't get there until we get to at least 60% of the population being vaccinated. So we got to move forward.
Yeah. So as a physician, I mean, you said this is one of the most trying times that you have ever been through yourself. What resources within yourself, within your family and community have kept you going? Because I've wondered it. I've seen you call twice a day when things were, you're one of those physicians who care, really care. So how do you do it? How do you do it?
It has been trying. I get texts at like, midnight from people I haven't spoken to in 20 years who went to school with my kids. I've got COVID. What do I do? And of course, I always answer those texts because that's what I'm here for. And, I want to tell you a little story. I was at 2 or 3 weeks ago when we launched this initiative. I went up to a food pantry in Harlem to sort of try and get the message out and see what it was like to interact with people who were maybe concerned about getting the vaccine. As we know that 35% in the Black and Hispanic community don't want to be vaccinated. And this food pantry was in East Harlem. So I went up to East Harlem, and with a translator, I walked down the line as maybe 100 people stood in line waiting to get their food. And this organization had set up a table where people could sign up to get vaccinated and they could go the next day to get their vaccine. And I talked to people on why they were hesitant to get the vaccine. And when I spent time with them, listened to them, validated their concerns, and helped them understand that maybe the concerns weren't really that valid and maybe were overblown, they relaxed and they said, okay, I'll go ahead and sign up for the vaccine. And why don't I bring my sister-in-law too? And can you call my mother-in-law? And, by just standing there and talking to people and connecting with them and listening to them, I was able to get 25 people to sign up. And the other doctor was able to get almost the same amount. So just the two of us were able to do that. But, as my husband always says, I always think I can change the world all by myself, but I can't. I really can't. I need help. I need all of you. I need someone like Davia to get this out there so we can all work together to get to our goal.
So, this saying that has gone through my head the whole time we've been doing this, which is save one life, save the world, right? I think maybe y'all should mute yourselves. If you could put yourselves on mute, there wouldn't be this feedback loop, I think. Yeah? Thank you. Anyway, save one life, save the world. And so you saved maybe 25 that minute. You're doing God's work every day. So what I'd like to do now, just to open this up, I'd like to introduce you to, is everybody getting some feedback the way I am, or am I the only one who's getting it? Yeah? No. Okay. So Victor de Castro is a creative director, but with years of major agency experience, who I believe is one of the most talented, if not the most talented, director and designer I've ever met. He's done our website. He's done lots of websites that I care about enormously. And when Jackie contacted me, I knew that the thing that was more important than anything was to get fabulous graphics, because there are a lot of efforts out there, but they're mostly talking to the head, not the heart. And what really makes you do this is the heart, right? That's what gets you over the hesitancy, over that line. But I didn't think of that. Victor did. And it was his graphics and it was his whatever that really caused us to be where we are. So Victor, can you come on and can you talk a little bit about how you came up with this idea?
Hello, everybody can hear me here?
Yes.
Well, so I think you just sent me a email explain your concept. So then I was driving for Roger, and Roger said, "Oh, I think that I forward to him the email or you sent to him also." And then we start to chat, and many ideas start to come up very quickly in a brainstorm. But after a while, I asked him, why do you think that people will vaccinate? What's the reason that will make people to vaccinate, to even to go that the direction, that direction? And I said, I have the answer. He said, what? I say, you vaccinate for you, for your family, and for the world and everyone. Like that in a car, it just happened. Then, of course, I got the domain Vaccinate4Love. Roger come up with all these ideas, all these headlines. It's really a team effort. Then goes to you, you give the directions, is let's make this vital. So it came down to, I think that's something that we can use to really make a little dent in the universe, as Steve Jobs said, and you keep saying. So that's what it is. I think it's something worthwhile to do. And we need help. Everybody that's here needs to help us spread the word, help some way, somehow. So that's it. That's the beginning.
That's the beginning. That's not it.
Yeah,
and
yeah.
So the graphics make all the difference, right?
Oh, yeah.
And there are places that have, we've been bootstrapping this. Jackie's done, a GoFundMe. We've been bootstrapping this from nothing. There are places that have lots and lots of resources trying to do the same thing. Yet, at least from my mind, the graphics here distinguish it.
Yes.
Can you just talk a little bit about your philosophy of how that works? Because I think it's important.
Yeah. Okay. So we know that the audience that we are trying to achieve, to get through, family is important, and they help each other. And in the end, everybody should have that concept. We are here for a brief moment in time, and we need to care for one another. So, Vaccinate4Love, that's the emotional aspect of the effort. It is an idea, but now how can you transform something that is so difficult and could be so cliche? Love, everybody says about love. So, and come up with something that we can identify as a campaign, as an effort. I think the logo was really what it started. And then came the imagery of the hand, because everybody does that sign. It means something to everybody. So it's like we don't create anything, as you know, as creative people. We just get what is there and give it back in a way that is understood and identify a cause, an idea, a product, whatever. And I think everything took place, became clear when the logo with the, with the syringe and the heart and the domain, because we want the URL be the point together. Usually we don't do that. A logo or a brand is just an icon or a name. But we put 3 things there, or 4, because you have doctor's orders together. It became this element that holds everything together. So I think we are lucky to get this right there, and it's working.
Yeah, so far so good.
So far so good. Yeah.
Thank you. Thank you. Roger Kyoki, let me ask you, Roger is a wonderful writer and brand strategist. So, Roger, how can we broaden the message? How can we extend this frame?
Well, anyone who has connections to any media companies, of course, be they cable stations, online, big online websites, billboards. There's a lot of empty inventory on billboards right now because of the traffic that has decreased since the beginning of the pandemic. So anybody who has a connection, who is a client of one of these media companies, it would be great if they just gave them a little nudge to run the PSA or to run the billboard. That would help sort of prime the pump for the campaign to go viral.
That's great. That's great. So let me ask you, how is branding for something like this different from other kinds of brands that you have done? How do you think about sort of a public campaign that really is trying to reach everyone with the call to action?
Well, branding is branding. It's a process. It's not just it begins with discovery. You have to do your homework. You have to understand what you're trying to say, what you're trying to convey. But ultimately, branding is about finding an emotional connection between either the brand, be it a product, an institution, a public, a not-for-profit, and its key constituencies. It's as simple as that, but as difficult as that as well. And so all brands, successful brands, tap at an emotion, a higher order emotion. And this one, is the highest order emotion of all, love. So that's really how you do it. And again, it sounds simple, but it's not.
Not so simple. All right, thank you. So let me take it back to Jackie. Jackie, where do you want this to go? Where can it go? What's your vision for how far we can take it?
I'm so hopeful that this is going to be the takeoff for collaboration. And as I've said, that's really the message I want to put out tonight, is that we all need to work together. And as physicians, we want to be there on the front line, but we need support in getting this message out and in addressing people's fears and getting them to really join in this effort to vaccinate. So what I would love this to be is all over the place. I'd love everyone to have Vaccinate4Love on their fingertips and in their mouth to say, listen, I'm going to go and get it because I want to protect myself and I want to protect someone I love.
Why don't we now open this up for questions? But what I do want to say is, somebody put in here, is any possibility of spreading this campaign nationwide? Well, I think we're thinking about that it is nationwide right now, and we're even thinking about internationally. Jackie, do you want to just talk a little bit about what your vision has been on that?
Yeah. Absolutely. So we're already partnering with, and if you look at some of our strategic partners, we have a partner in Alabama who we're working with, and we've partnered with a really interesting group of physicians in Northern California called Vaccinate, VAXN8, and they've made a really great video that's gone viral to Hamilton's Not Going to Give Up My Shot. And they've been partnering with us, and we are partnering, of course, with people on the East Coast. And Europe's vaccine is rolling out, and we hope to sort of spread this over to them when they sort of get the vaccine underneath their feet, because it's a message that's so important. Again, we need to do this together, all together. If we all pitch in, we can overcome this. Absolutely.
So, what we've got on the website now, we've got Jackie talking about, as a doctor, her advice to her patients. And then we've started getting in more videos of other doctors, friends of hers, other top doctors, who giving their videos of don't hesitate, vaccinate, and with varying degrees of acting ability, some of which is quite impressive. And I suggest that you go take a look at that. We're getting more all the time. We're going to continue to do more videos. We've also done a PSA, and that of Jackie, that is a PSA. We're hoping to get that out, and there are more PSAs to come. And we've got New York One coming to talk to us tomorrow morning at Jackie's offices. And so we're really trying to start to get this truly blessedly viral, not diabolically viral, to carry that analogy too far.
Jackie, can you hear me?
Absolutely.
Have we approached the social media platforms at all? Facebook, Twitter, Instagram, to see if they could get on board? Because clearly that would be the fastest way to spread anything in this country.
So I'd like to introduce John Conley, who is our past president of Castle and Conley Limited Top Doctors, and he really founded the organization, and it's been just an incredible support to me throughout my career and definitely in this initiative. So John, you know a lot of people. I would love that introduction. Just as one person, it's really hard to get in. And Davey and I have had a lot of inroads. I want to thank some of our strategic partners, like the Wounded Warrior Project, which is addressing veterans' needs. We have the Real Estate Board of New York. We have Partnership for New York. We have United Way. We have Plan Heal. We have, and if I forgot to mention, we have just a whole bunch of wonderful people who are partnering with us, but we could just use so many more. So any suggestions you have, we're on it.
Well,
And we have a lot of those
also,
people on this call too. So
Yeah.
a lot of potential partners on this call as well.
Yeah. And
So,
John, I'd love to talk again.
organizations like AAA and AARP, who have massive memberships, I think we should try to reach them as well. And, this is a cause I don't think anybody can rationally argue with. And there might be a chance to get them on board.
That's a wonderful suggestion. Thank you, as always.
And the Girl Scouts, which I've been on the board of forever and a day, we're thinking about how they help too. So you start to get those girls out there. Maybe we put it on some of the cookie boxes, right? There's an idea for you. There's no end of ways.
Top seller with 32,000 boxes of cookies. That's a lot of cookies. So I'd love to maybe answer some questions. We have like 26 questions now. So maybe we should go.
Okay, Trang, it's over to you to figure out.
Fantastic. Hello, everyone. So at this time, we'll open up through the formal Q&A portion of our program. Just a quick housekeeping note. If you join us tonight through a friend or forwarded link and would like to be considered to be invited to one of our future events or receive post-salon information, please send an email to salon@teminandco.com. So you'll be included in our growing salon family. I'd like to call on Tammy McMiller to ask our first question, if she's still with us. She is actually one of our sponsors, our strategic partner. She's the co-founder and CEO of Plan Heal. So if Tammy, if you're still with us, feel free to go ahead and unmute yourself and ask your question.
Tran, I'm still here. Thank you for the introduction. Hello, everyone. So here's the question about COVID-19 and the variants of the strains, Doctor. Given that the strains are changing rapidly and maybe monthly, is the vaccines we are getting now going to protect us from the new ones that are growing monthly?
That's a great question. And I just want to give another acknowledgement to Tammy. She is so creative and has come up with all these really amazing technological things that are way past me that we would love to implement. So Tammy is a real innovator, and we're so happy to have her as a strategic partner. So it's a great question because there's a lot of concern about the variants. And the thing that we need to remember about the variants is they're variants. It's not a completely different strain. It's just a little bit of a change. So we as physicians feel that the vaccine is going to mute your response to the variants, which means that doesn't mean you won't get something, but it's going to be more like a cold or the flu instead of ending up in the hospital dead. And when we look at SARS-CoV-2, which is a COVID-19 variant, it has a couple of variations. I think we're up to about 10, but when you look at a virus like the flu, we get 15 or 20 per year. So there's definitely a chance that we may need boosters again next year to some of the variants, but even if you weren't to get the boosters, the vaccines that are out there are going to keep you safe. So that's the major thing.
Thank you, doctor. And then lastly, for those who are not wanting to get the vaccination, can you please demystify if taking supplements and nutrients will equate to protection as the vaccine? Because there's a lot of stories out there saying just increase vitamin D, C, and zinc, and you'll be okay.
Yeah, and that's another great question. And for those of you who know me, I'm a big proponent of complementary medicine. You know, there's so much as physicians we don't know about of the other side of medicine, and we have to embrace it. However, this is a bad one, and vitamin D and vitamin C is not going to protect you from this one. It's going to help you if you get sick, but it may not protect you from some of the severe complications of COVID-19. So yeah, keep your immune system strong, but get that vaccine too.
Thank you.
Great. Thank you so much, Tammy. At this time, I'd like to call on Jan Alexander. She has a question that a few of us have echoed in the chat as well about talking points. So Jan, if you're still with us, please unmute yourself and go ahead and ask your question.
Did you say Jan Alexander or
Yes,
Anne? Oh, okay.
I said you, Jan.
Yes, okay. Yeah, so my question was that I know people who are resistant to the idea of getting the vaccine because they just don't trust conventional medicine, which, you know, ties into just what Jacqueline was just talking about. Yes, we have a friend, in fact, who said, well, I'll just wait until everyone else gets it and then herd immunity will be here. So yeah, I was interested in talking points in cases, you know, in that case, how do you convince people who just basically feel that any kind of conventional medicine is going to do more harm than good, that this is really important?
It is really important. And again, I think you have to do a risk benefit profile anytime you make a decision regarding anything you put in your body. But I think the risk of getting COVID-19 right now is just too high, and especially some of the variants. And, you know, I've taken care of 20-year-olds who have ended up in the hospital on ventilators. And I've taken care of 20-year-olds who get a small sniffle. And if, as physicians, we only knew which group that you were going to fall in, we'd be comfortable supporting that, but we don't know. And you may be one of those people who ends up in the hospital intubated and one of the long haulers where you're sick for years and years. So we just can't take that chance. This one is too dangerous. Okay, not taking the flu shot. Okay, I can support that. But the COVID-19 vaccine, you have to take it. And the other point is, and this goes to our campaign, you're being a little selfish by doing that, because you may be one of the lucky ones and you do have a strong immune system and you may not get symptoms, but then you could spread it to someone like me who's older, or to your grandmother or someone else, and they could die from it. And that's just being selfish. We have to do it for ourselves. We have to do it for the people we love, but we have to do it for us all. This is a big one. We all have to pitch in. So I think appealing to people's sense of self and love of city, community, and loved ones.
Thank you.
Great. At this time, I'd like to call on Janet Ehrlich. Janet, if you're still with us, please unmute yourself and go ahead and ask your question.
Hi, well, thank you for your amazing work. My question was, what is your sense of how long it's going to be before we have an idea how long the vaccine would be effective for?
It's a really great question. I was coming up in the elevator today and my doorman didn't want to get the vaccine. So of course, you know what I had to do? I had to stop the elevator and talk him into getting the vaccine, which I did. It took me 10 minutes, but I talked him into it. You know what he was saying? He was saying he wanted to wait to get the Johnson & Johnson because his cousin had told him that Johnson & Johnson is going to come out with a second shot, which we don't think they are, that's going to make it 100% effective. And I'm like, where did you get this one from? Just go get the vaccine. So after talking to him, but again, I mean, I coming off a little bit like, yeah, just do it. But no, we need to listen to people. We need to understand where they're coming from, and we need to respond in a scientific and supportive manner. So again, when we look at the way that SARS reacts, the COVID-19 virus, it's very similar to MERS and SARS, which was the previous two bad viruses that were out there. And what we found with those viruses, where COVID-19 is acting very, very similar, is that immunity stayed for many, many years. And we really feel, I really feel, and many people agree with me, that the vaccination is going to confer years of immunity. Now, that doesn't mean that we may not need a booster in the future, but it's going to protect us. I really feel confident with that. So get it.
You know, if I can add one thing.
Already did.
Good. If I could add one thing, you know, we're in this strange confluence of so many cultural mores and movements. Right now, disinformation spread mouth to mouth from your cousin or over the web or whatever is so, it's so everywhere. And it is so moving to people that people have lost some kind of compass, intellectual compass, on being able to figure out what's true, what isn't true. And people are using that, governments and everything else, obviously, to manipulate it in commerce and in politics and everywhere else. So now you've got people who can be, with quite great reason, suspicious. And then they're compounded by all of these lies and misinformation that have been putting forth for a long time, but that's culminating in this, right? It's politicized and metastasized in a way that I've never seen before. I mean, I'm sure there have been things like this, but I've never seen it before. So the trick is to how you get the true north and how you talk to people about reality and what is true. The only way I think it really works is when you have a trusted doctor, a top doctor, one of the 1,200 doctors who's signed on and one of the millions more who will, to actually give you that advice. And if you can trust in your own physician, if not medicine writ large, that's the way to do it. Only way there is.
Yeah, and I just completed, I did a women's leadership symposium recently, and someone asked me the question, what are the good things that have come from this pandemic? And I was like, oh, what a question. But you know, when I sat and thought about it, there are some good things that have come from this pandemic. And one of the things is the strengthening of the doctor-patient relationship. Thank you so much for people who trust us, who rely on us, and we want to be there for you. And that, I think, is one of the good things that's come out of this. I think that people realize that hopefully your doctor's there for you and that we do have some use in society. And that's why I really wanted this message to come from physicians, someone who we hope that you can trust. If you can't trust your doctor, like, you better find somebody else, but you better trust your doctor. So I didn't want it to come from the CDC. I didn't want it to come from the Department of Health. I didn't want to come from the city. I wanted to come from your physicians. And that's why this message is. And that's why I think that we're having success in getting strategic partners, because it is a message that comes not from the Biden administration, not from the Trump support, not from anyone, from your doctor. We want to be there for you, but you have to help us keep you healthy.
Great, thank you. I'd like to call on Amy Baxter. I know she's joining us tonight. She had some interesting comments in the chat, and I know she recently did a testimony to the HHS Vaccine Advisory Committee about needle fear and pain in adults. So Amy, if you're still with us, feel free to make some comments on that. I know that's a big issue with some adults just not wanting to get the vaccine because of fear.
Hi, yeah, so I'm a pediatrician and I do research in needle fear and needle pain. And the estimates are that about half of the 28% of adults who are afraid of needles actually espouse more an anti-vax statement or sentiment, even though the real underlying issue is that they're afraid of needles. This started growing in 1982 because we started vaccinating kids who were old enough with boosters so they remember as they get older. And even if they don't remember, that's the first time they were shot with 4 injections at the same time at age 4, and they can't abstract. So there are a couple different government groups that are working on materials for vaccinating adolescents and college students, because the biggest group of people who say they're not going to get vaccinated is those between 18 and 35. And so to address this for these people, a couple of things that have already been said. So love and protection are really huge messages. Anybody who is truly afraid of needles, which is more like a 7 to 10% subset, they can't even hear the word needle. They can't see a picture of a needle. They are going to panic. And so what helps them is understanding and being told this is to protect your family. This is for love. I mean, it's such a great idea. This is to get protected and to protect people around you. So duty is something that appeals to them. There's a definite, like has been said in the comments, there's a lot of conflation with political mistrust of the government and not wanting to get vaccinated. But religious leaders are really helpful. So focus on the family, having doctors who are avowed Christians saying that it's safe and saying that it's important. That actually is a very instructive demographic that can overcome some of the issues that are politicized. And that's also true in the military. So I always talk too much, but there's just a couple things. So addressing pain and fear are certainly issues that are being worked on by two groups that I put in the chat, the Meg Foundation, and then there's 5 different subsets that the government has given grants to. I can certainly share the names of the people I know who are working on them, but they're all trying to develop similar materials to explain about how a fear of needles comes out as an anti-vax attitude, but you can actually, if you address some of the issues with fear, you can address the anti-vax if you focus on the protection of people they love.
Amy, thank you so much. You're signed up. Sorry, we got your email. You're not getting away from us. That was so helpful. Yeah, exactly. And we would love to have you do something on our website and help people to understand, because that was really, really helpful. So thank you.
Fantastic. Thank you, Amy. Rachel Patterson, I know you had a couple of questions for us. If you could unmute yourself, feel free to go ahead and ask your questions.
Well, my question is kind of a bit of a repeat, maybe slight expansion on earlier questions. So while I'm looking forward to the vaccine, there are some very understandable stumbling blocks that we need to address, people's assumptions and fears. And several of us have been commenting in the chat. And I've heard anecdotally about fear of the vaccine quality because it was developed so quickly. Stories in history of the US medical establishment experimenting on African Americans, this Tuskegee syphilis. I didn't grow up in the US, but I've heard of this. I think that's it. So, and then people are balancing the fear of history repeating itself with a societal push to vaccinating the more at-risk populations, which do tend to be more BIPOC. How do we address those concerns? And other people have also brought up the anti-vaxxers.
These are great questions. They really are. And, you know, when I was walking around, you know, East Harlem, trying to get people to sign up, those were some of the questions that came up. You know, I don't think people came out and said, like, the Tuskegee trials make me, but they were very distrustful of the government and what the government may be involved in. Again, it goes back to this really has to be a coalition, and it has to be a coalition that's led by science. And that's how I think we move through this, is science. Yes, this was a vaccine that was developed very, very quickly, but our Food and Drug Administration is one of the most stringent food and drug administrations in the world. And you really have to get through some hoops. Now, they shorten those hoops, but this has gone through, all the vaccines have gone through a pretty rigorous trial. And we see now with the AstraZeneca vaccine, you know, the US is saying, okay, hold on, there's some inconsistencies with the data. Let's not approve this until we look at it. And I think that speaks a lot to, we're not rushing into this. We really are evaluating it. And I think at this point, there's 118 million people who have received vaccines. That's a lot of people. And we look at the side effect profile, and it's been really low. You know, I know in Europe, there were 13 people who developed blood clots, but that was out of 25 million people. You know, you can take amoxicillin and you can get a reaction, and we don't, you know, have that as a headline. So we have to put this in perspective and not blow up the complications. Nothing is foolproof. But if 118 million people have gotten the vaccine and we've seen minimal side effects, I feel really comfortable about having anyone I love get that vaccine. My son should go get it, but he's not ready yet, but he's gonna.
Great, thank you. If Bob Mueller's still with us, I know he has a question about herd immunity. So Bob, go right ahead.
Okay, my question is, I'm not sure that I understand, and I'm sure that most people don't understand what herd immunity really means. Commonsensically, what it means to me is that because you have gotten so many people who have produced antibodies and stuff and are no longer serving as reservoirs for the creation of and the spreading of the virus, the community as a whole is protected by the lower frequency of contact. However, if you're an individual who has not had the disease and you've not been vaccinated, you don't have any protection. As an individual, the herd's protection matters little to you if you are actually put in contact with the virus. That's my sense. Is that true? And if so, what do we do about defeating that misconception? Well, I don't have to do anything. Everybody else will do it, and then I'll be fine.
Absolutely. And again, another great question. And when you think about the way that the coronavirus acts, the reason why we are where we are today is because it is so infectious. So one person gets the virus and then they can affect 10 people. And each one of those people can affect 10 people. And it can be passed very, very easily between people because it's passed airborne. So someone can only breathe on you if they're close enough and they're infectious enough and you can get it. So that really is the reason why coronavirus is so difficult to eradicate. Now, the problem that we have is there is definitely a subset of the population who don't get symptoms but are still infectious. And that's where we get into trouble. So the philosophy behind herd immunity is if you are immune to the virus, either by getting it or being vaccinated, you cannot pass the virus, or less than 1% chance, because the way that we pass the virus is it infects us and then we pass it along to someone else. If you have antibodies or a vaccine, the chance of you getting infected with the virus is less than 1%, well, less than 5%, but in truth, probably more like 1%. So the philosophy is if all of us can get vaccinated, then we're not going to infect each other. So each and every one of us has to do our part in getting vaccinated. If each one of us is selfish and say, I'm not going to get it because the person next door to me is going to get vaccinated, that's not going to work. We all have to be in this together. This is the time when we need to support each other. And that's the message we need to get out. Do it for yourself. Do it for the people you love. Do it for our city. Do it for our country. Do it for our world. You got to do it.
Thank you so much. Howard Meitner, hi there. I know you have an interesting suggestion for a partner. If you want to go ahead and unmute and ask your question.
Yeah, thank you very much. This has been fascinating. My big question is, you know, the Biden administration is grappling with this on a national basis, and they have money. I'm wondering why, as a strategy, you wouldn't reach out to them, because you're trying to accomplish the same thing that they are, and perhaps convince them that they should give you some of their budget so you can join them in the effort to spread the word.
Davey, I'm going to pass that one to you along as our chief strategist.
Right. Thanks for that, Jackie. I think you're absolutely right. I think you're absolutely right. I mean, there are a lot of places out there that are doing great work on trying to get to herd immunity, on trying to get people to vaccinate. There is, unfortunately, there are a couple of strands that are going at the same time. One is probably because of the last 4 years, probably, and I can say this, and probably there is a distrust of what the messages are from the White House or from the White House, forgetting that there's been a huge change in the White House in the past 6 months. And so a lot of things were not necessarily true. So how do you start to get the confidence of what is true? That's number one. Number two, there are some wonderful organizations who are doing wonderful work and who are very well funded. Their stuff, very scientifically based, and if you look at it, and we've looked at a lot of that, doesn't have the same heart appeal, if you will, and I think power to motivate as what we're doing. So the idea is, our hope is to partner. This is big enough, we can all have a slice of this particular effort to save the world here, right? So to do is, and this will come, is reach out to many people or have them start to reach out to us, which has also happened, so that we can start to combine our efforts. And if ours speaks to the heart, maybe there are others who want to support us, take some of that wonderful funding that they've got, as opposed to, our bootstraps, and infuse that so that we can go further and farther and better with these messages that actually can change hearts and minds. I mean, given the fact, I wish we could have a Jackie hotline, which if you want to hear advice from Dr. Jacqueline Jones and Dr. I forgot the wonderful doctor who spoke before. If you want to get advice from them, pick up the phone and you can hear it. Well, hopefully on our website, we're going to have more and more doctors who are going to have videos on there that will be able to give those messages too. Lots of people can support that, and we can work together to do it. So yes, Howard, help us. I think we can reach out, but I think the fact that this emanates from physicians gives it a credibility, we hope, that is beyond all others, because it really is a voice of who you trust.
Great, thank you so much. Gerald Corbett, I'd like to call on you. I know you had a question about how much of the campaign is sort of affecting the effects of the vaccine. So if you're still with us, feel free to unmute yourself and ask your question.
I was just curious if, well, good afternoon to everybody here. I was just curious whether anybody has used cases to let folks know that for some populations there is no effect from the vaccine. I've had 2 Moderna shots and there were no effects whatsoever.
You're so lucky. And that's a message that we need to get out there, that so many people have gotten the vaccine and really haven't had an effect. We can't promise that people aren't going to have some side effects, but the side effects have not been severe. So that's really a message that we want to get out there. Can you tell all your friends about that and make sure that they all know?
Oh, believe me, I do. In fact, my wife is younger than me, but so she's not qualified yet, but she drove 2 hours to Modesto from Foster City to get her first Pfizer shot. So, and she had no effects either.
That's wonderful. Well, thank you so much for saying that.
Yeah. And you know what? So I did have an effect from the second Moderna shot, right? And all for that 24 hours, 48 hours when I was sort of shivering under a blanket, I have never been happier. Because you know that all the antibodies are like, they're just growing in you and growing in you. And isn't that what you want? I was happy to have a visible sign of it.
Yeah, and I had a side effect too after my second Moderna shot, but same thing. I'm sitting there in bed saying, okay, go immune system. And I knew it would be gone by the morning, and then I would be safe. And I could be with my family and my friends, and I cannot be afraid. And I think that's the biggest thing that has echoed throughout our country this year is fear. Fear of walking down the street. You walk down the street and people get out of your way. And it's, I just want to be with people again. I'm very much a people person, and to have this forced isolation and not being able to hug and not being able to be with the people I love is really hard. And we can get there together.
Thank you. Karen Kerner, I'd like to call on you now. I know you had a question about how to address U.S. service members and getting them vaccinated. So if you'd like to go ahead and unmute, feel free to go and ask your question.
Hi, thank you so much. And hi, Davia. So the Brookings Institute recently did a study. They said as many as 1/3 of the military current service members have opted to not be inoculated at all, vaccinated at all. Do we need a special campaign for them? This is service to your country. Is it potentially a different message? How do you get through to them? And second, with regard to receiving government money, there is currently the possibility of getting an earmark directly to you guys. Yeah. They're bringing back the earmarks. And some members of Congress are asking for, like, get your proposals in by the end of this week, like by Friday. So, I mean, we don't necessarily know what the rules may or may not be for receiving it, but you're a not-for-profit, so that increases the opportunities perhaps to get an earmark.
Well, thank you. We would love that.
Help us.
Go ahead, Debbie.
I'll help you. Of course. I'll help you.
Yeah, Davia does this work between midnight and 6 a.m. and she's not doing her full-time job between 8 a.m. and 5 p.m. And then she eats for like a half an hour. So it's
and then I call you up, but it's my doctor. That's right.
Yeah, it's amazing. Yeah. So we do have a special outreach, and we've been so lucky to partner with the Wounded Warrior Project. And I will thank Ann Akers, a dear friend who connected me with the Wounded Warrior Project. And that's an organization that reaches out to veterans. And through the Wounded Warrior Project, we're hoping to connect with the Veterans Administration, because it really is a group that you think that they would be so on getting vaccinated, because especially our servicemen, they're out there, they're risking their lives for us in so many ways. We really should be one of the groups that should be protected. But, again, I think that it's difficult sometimes when you get a cultural view of not getting vaccinated. So again, I think it goes to our message that you're not just doing it for yourself, you're doing it for the people that you love. And you have given your life for your country. Give that extra step to protect your country in the way by preserving your health and our health. And I think that's the message that we're going to get out, because nobody joins the military without some altruistic, feelings towards their country. So I hope to get it out through that message.
Yeah, I would just perhaps make the distinction between the veterans groups who have already finished their service and the current service members.
Yeah, that's a really good point.
So just that you may need to get some generals involved. And
yeah, so I think we need coaching on that one, but we have such great strategic partners, and I know with their support, we're going to get that message out. So thank you. It's a great point.
And we can, I'm going to be dreaming of earmarks. Therefore, I think we can talk.
Okay.
Soon. We get in by this week. I mean,
Yeah.
Yeah. Well, we can do it.
No pressure.
Okay.
No pressure.
No pressure.
Thank you so much for your question. Carolyn Chin, I'd like to call on you now. I know you had some interesting comments in the chat, and I think it's pretty safe to say that the majority of us on this call are pro-vaccination, but how do we target those who may not be so eager? So Carolyn, if you can unmute yourself and ask your question, go ahead and feel free.
Okay, am I unmuted now?
You are.
Okay. I just want to make sure that we can show some efficacy before we spread this to the world. Okay, because we don't know that something that would appeal to you or me or anyone on this call would appeal to those that are resistors, the anti-vaxxers, those that just don't have enough information or have cultural issues with the with this matter. So I think we can actually do some testing to make sure that we have the right messages. For example, when I was at AT&T, we ran our ads among the Asian American employees and found out that there were cultural flaws. For example, the number 4 was used, and 4 is synonymous with death in the Asian American community. So I think that if we could do focus groups or whatever, targeted specifically against large groups like the current military, among pregnant women, among immunosuppressive, which I am one as a transplant recipient, we can get not only facts out, we may be able to move the needle. One other thing that I want to note is during the last election, the first time I've ever seen this, there was tests that show that highly targeted email with messages provided by people that were similar to the target market, like the Trump supporters, was actually able to change the vote of these people by a material amount. I have never seen this ever in all my life marketing. So I think we should take a look at some of these new techniques to see if there's a way that we can show efficacy and then spread it to the world.
What great suggestions, and we'll definitely incorporate those suggestions and think about them. Thank you so much for joining us.
Victor, were you wanting to say anything about that? Roger?
Roger, are you there?
I had to unmute. I'm sorry.
Yeah.
I mean, you know, you hear about that a lot, particularly in political. You have to have a database that is a psychographic database as opposed to a demographic database. And there's some companies that do that. And actually, I have one in mind. So there you go. Maybe they'd be interested in partnering.
And maybe they do it pro bono.
Well, we would hope.
Oh, yeah, it has to be pro bono, yeah.
I'm a big person for please, will you do it for us for free?
And maybe
You know,
yeah.
It's Carolyn again. I had actually worked a lot with John Zagri, and we were prepared to do some of this kind of marketing in Florida. So, I mean, that's someone that has a database that probably would help us.
That would be wonderful. Thank you so much. We love any help we can get.
Thank you.
Thank you, Carolyn. One of the questions I saw that came through, the person had to hop off, unfortunately, but it was of interest to me, and I'm sure folks on the line here who have children and grandchildren. So, Becky, what can you tell us about the latest update for vaccine being available for children under 16?
Mm-hmm. So the studies have just started on vaccination in children, and they're going to go through the same clinical trials that we did for the vaccinations in adults. The reason why the scientific community focused on vaccinations in adults was mostly based on the research that's out there. And I completed a research study earlier on in the year where we looked at the rate of asymptomatic COVID-19 infections in children. We looked at the asymptomatic infections in children between May and August. And we found a rate of 0.4% rate of asymptomatic COVID-19 infections in children. So they really are not getting that sick. And when they do get infected, they tend to not get sick and they have a low rate of getting infected. So we really felt that our efforts need to be focused on the people who had the highest chance of getting sick and the people who had the highest chance of getting very sick. So I do think that children will get their vaccinations, but I probably don't think it's going to be till much later in this year, probably till maybe around Christmas. So, but again, we don't have to be as worried. If the majority of adults are vaccinated, then the kids are going to be safe because they're getting it from us.
Great.
What a great question. So thank you.
Sure. So if anyone else has any questions, feel free to enter them in the chat.
Trang, I think that Anne has a question. I'd like to ask her for her question. Anne, you have your hand raised. Yeah. So just unmute yourself.
Trying to
there
unmute.
We go. Okay.
So I had two observations and one question. First, I'm very happy to hear that you're going to have partnerships in this, because as I mentioned to Davia, I've been involved in the medical center at Columbia, and they have a big program. The public health school has a program. The social work school has a program. So just at Columbia alone, there are a number of programs. So I think, partnering would be a great thing. The second thing is, I hope that part of all of this is also to make the vaccine itself more accessible. Because I think it's one thing to convince people to get it, and then if it's not easy to get it, if it's complicated, then I think it makes it more difficult for people who are hesitant to get it. So those were my two observations. My question was, do you feel that there are any differences in vaccine hesitancy and the response to different outreach programs between men and women? Are there gender differences?
I think the research has shown us that there is gender differences. The recent PBS, I think it was PBS poll that came out showed us that 45% of white Republican men are resistant to the vaccine, 35% of the military, and about 35% of Black and Hispanic Americans are resistant. So if we look at the white Republican men and the military, that shows us that there's a much higher rate of vaccine resistance in men than there is in women. So I think we need to address that from a cultural standpoint and targeting. And again, sort of getting to, you're doing it not just for yourself, because, maybe men are feeling like, okay, I'm in good health and I'm strong and I'm just not going to do this. But you need to remember, you're not doing it just for you. You're doing for the people you love, the people who you want to protect. And I think that's the message that will resonate more. And to get back to your point about partnering, Columbia has been absolutely wonderful, as Weill Cornell has been. We're reaching out to Montefiore. I'd love to start to get some partnerships in the South. I'd love to get some partnerships in California, where people are getting hit, and in Florida. We have a meeting next week with a physicians group from Columbia, from Cornell. We have Montefiore, we have NYU. And what I'm trying to do is put together a group of physicians who can do Zoom conferences to churches, to businesses, to anyone who needs to speak to a physician. As I said, when I walked around that food pantry in East Harlem, I really could feel how much people wanted to get information and wanted to get information from physicians. So that's one of the impetuses of Vaccinate4Love, is to organize the physician community. And I wish I could reach out to every doctor in the US, but I don't have enough time for that. So I went to Castle and Conley, and we're trying to mobilize the Castle and Conley doctors who are leaders, and hopefully they can mobilize doctors at each one of their hospitals and communities. So I see this as sort of a grassroots movement where if we all pitch in just a little bit, we can move that needle. So all great suggestions. So thank you.
And Anne, I just want to say that, I know that you gave me the name of a doctor at Columbia who is fielding a very big effort like ours. And I've yet to reach out to him, but we want to reach out to him and talk about partnership with him and talk about what the possible is. So I think that that's very valuable. And that is exactly what we want, because this is leveraging. And the more of us there are to do this work, the more we can leverage it. So thank you for that.
Thank you, Anne. Oh, go ahead.
I think that Chip Boykin has had his hand up. Yes. So I want to make sure that Chip gets called. Hey, Chip.
I've been listening through about this, and most of my career was spent in pharmaceutical industry as well as in the military, infectious disease with Bristol Myers Squibb, Glaxo, military medicine with Fleet Hospital, dealing with the Marines. But one of the things that I have found, and it's tragic and unfortunate, is the inconsistency of messaging combined with problems of distribution, problems of access. I mean, I had to drive 5 miles to my church and I was good to go. Where I'm hearing about other people here in Colorado having to drive to Buena Vista. So when you start piling these type of things on, the bubble becomes a lot larger. One of the challenges that I've come across is, for instance, having worked on the AIDS drugs when I was with BMS, the studies that were conducted for those drugs amounted to a couple hundred patients, maybe 1,000 if I'm, and this was 20 something years ago. And I don't even know if we had studies that were that large. Okay. But we've got 37,000 people who were in a study. We don't talk about that. Okay. Probably because the old heads that were around when that type of stuff was going on, are no longer around. So maybe they're youngsters that are trying to, talk about the safety or whatever. But that alone says that the tails, are not as deadly and dangerous. All the AIDS drugs were fast tracked, just like this one was, except 37,000 people in one study. If we don't talk about that as a marketing message, we're missing the boat. The fact that mask wearing has lowered the flu rate in this country, we don't talk about that as a side effect, benefit, whatever at this point. So there's opportunities for us to really hone in on some very scientific, positive things and try and minimize some of the stuff that is going on. Because if nothing else, this pandemic has shown us the discrepancies in how we deliver medicine to certain groups of people. But I think one of the biggest things out there is if my doctor says one thing and your doctor says something else, and they're not on at least a fairly similar page, you have the cascade and the buildup and the lack of confidence. So I think, as you go forward, you've got to use all the things that are at your disposal and make sure that there is a consistent, simple message. Keep it simple, stupid. Okay.
Such a good point, Chip. And that's why we kept our slogan to doctor's orders, don't hesitate, vaccinate. Your doctor is telling you, you got to get this one. And that's what we want to do, is keep it really simple. And again, as I was talking about, what are the positive things that may come from this pandemic? And one of the positive things is to shine light again on the disparities to information, access, and resources for disadvantaged communities. And I think that with the Black Lives Matter movement, as well as the pandemic, we're seeing those disparities really starkly in view. So if anything good comes from this pandemic, that's one of those things, to help us to concentrate our efforts. And that's, again, where this Vaccinate for Love campaign started, to really get the message to the Black and Brown communities. But I think it's even bigger than that now. We need to get it to the world, but we also need to really focus on ways that we can partner with nonprofits to make sure that people who may not have as easy access as they could get that access. And again, as I was saying, in East Harlem, we set up a vaccination site at a food pantry. So the people were there getting their food, and all they had to do was walk 10 feet and sign up for their vaccine, and they could go the next day. And that's the type of partnership we need to get. And that's why we're trying to reach out to hospitals, to nonprofits, to partner people together. We can do this if we work together. And Chip, people like you are so important. I've been doing this for 31 years. Obviously, you've been doing that for a long time. We have sort of collective knowledge of having gone through all this. And it's important to us to use our experience to get out there and say, this is what we've been through. We've been doing this a lot. You really got to do this. So thank you so much for that voice.
Yeah, I mean, just to add on to that, the disparity, obviously, as an African-American, a minority in this country, is obvious, but the disparity in the U.S., period, in terms of us delivering healthcare is frightening. And that should also be, very visible at this point and stuff.
Let me just point out, I want to tell you a story of something that actually worked, and in my experience worked extraordinarily well. There's an organization called Bronx Care, and they have a lot of centers all throughout the Bronx where they offered vaccines. I mean, probably 26, way more than that, places. And they offered them in small doses, etc. You didn't need to get on with a computer. You didn't need a computer. All you needed to do was make a phone call, and they were amazingly polite, wonderful, and very respectful of every person, and ended up working with them to get solved. Now, I'm sure that when you put on a program such as this one to reach pretty much everybody in the country and world, it takes enormous organization to do that. And frankly, we didn't have the political will before January 21st to get that to happen either. So now Biden, everybody's playing catch up, but they're doing a pretty darn good job of it. And still, even in the Trump administration, they did work with the pharmaceutical companies to start to partner with them to do that in ways that are very different and better, frankly, than what the EU did or other parts of Europe. So I do want to say that we do need to look at the half full part of it. And there are enormous numbers of people who have gotten vaccinated. Can we do much, much better with access? You bet. And what was really interesting when we were thinking about it, when Jackie sort of sent me that email, can you do anything to help? And I started to think about a campaign, started to think about the top doctors. That's what we had at that particular point. And the real critical aspect was, what can we call it? What are the messages that we embed in the branding that will speak to a broad swath of people who, many of whom are very hesitant about it for many very good reasons. And I've never seen a campaign before that had three such sort of disparate things: Vaccinate for Love, doctor's orders, and Don't Hesitate, Vaccinate. But they work together. And I have to tell you, one of my clients, the CEO of one of my client firms, actually came up. I sort of said to her, yeah, we're thinking about all different kinds of things to call it, and it has to be really good. It can't just be something else that fades into the woodwork. And she came up with doctor's orders. Now, fabulous. That's good. And it had been used a little bit before. Don't Hesitate, Vaccinate. Great. It had been used a little bit before. The Vaccinate for Love, never. So it's sort of an umbrella. So we're making a lot of this up as we go along, both for the branding and so much more important for the delivery systems to every human being on an equal footing within this country and world. And that's going to be a social experiment that we continue to push forward for a long, long time.
Mm-hmm.
Thank you. Hi, Lisa. I know you've been patient for a little while. Feel free to unmute yourself and ask your question.
Hi, everybody. The main thing I just wanted to say, two things. There was the story on NPR this morning that is very important for everybody that's interested in this topic to listen to, because there was a gentleman on there. He represented a large group. I don't remember which, but he was saying that to call it vaccine hesitation actually almost disrespects what's actually behind the wish not to get vaccinated. Basically, he was saying it minimizes their concerns. That it's not just about, and he mentioned the Tuskegee experiments. He said, that's what people say, but when they did the survey, that most of the people that they talked to didn't even know what it was. They just knew it was something about experimenting on Black people. They didn't even really know what it was. It had a lot more to do with their relationship with the medical community, whether Black or military or Republicans, just these large swaths of people that are not wanting to get vaccinated, they found a lot more to do with distrust of the structure, the basic medical community, everything about it. Some people have had very bad relationships with their doctors. They felt they were treated worse than others. Terrible stories. But anyway, you should listen to this story. I just encourage you, because it's not all about medical history. It's about lack of services in those communities. So number two, I belong to a group called the Connecticut Community Foundation, which serves 5 towns around Waterbury. And what they do is they make grants to all sorts of nonprofits in the area. And I can bring this group's information and website up before the grant committee, excuse me, I'm tired, to see if they have suggestions for us to get the word out in the Connecticut area, right, where Waterbury actually has a very good medical system, but there are other towns in Connecticut that don't have such great reach, right? And I think that's something that we can all do, right? We all belong to some sort of community groups. We all know people that are reaching out to people like, you know, in poorer neighborhoods, in neighborhoods that are not well served by the medical community for whatever reason. They don't have the clinics, they don't have the doctors. And maybe they will have ideas for us as to how to reach those people, because often those populations are not on the same media we are. They might have a phone, but they don't have the computer. These are the people whose kids are falling the furthest behind in school, et cetera, et cetera, et cetera. I'll shut up.
You know, Lisa, those are such great points. And one of the points that I hear you echoing is connection, is us making a connection and validating people's concerns. And I think that is so important. You can't just say, and that's why our message is, you know, for love, do it for love. Not do it because we're telling you to do it because you want to protect the people you love and protect yourself. But it's so important for us to listen to people, to understand their fears, and to try and help them overcome those fears. And that's one of the things that we're trying to do with Vaccinate4Love, is to set up these community-based organizations where we can partner with churches, with nonprofits, with food pantries, where we can get physicians who are compassionate, who are caring, who want to help. And every physician wants to help, and every physician wants to be compassionate. Maybe they may not be compassionate at that particular moment, but we all want to do the best that we can. And this is an opportunity for the medical field to step up and do what we know that we can do, is to help our patients make the right decision, to help validate their fears, to help to explain to them why their fears may not be something that they need to be overly concerned about. And we're going to do that through churches. We're going to do that through nonprofits. We're going to do that through going out in the community. But again, I need everybody's help. So that's why we're here. And people like you are just what we need to hook us up with organizations that help us to get in the community. And people like Amy Baxter, who is on the phone, you know, I haven't met her before, but she's another physician who obviously wants to become involved. So just thank you. I can't tell you how much I appreciate your involvement. We really do appreciate it.
Well, and I would counsel you where churches are concerned, and I think this would apply to temples too, rather than trying to go to each individual church, there are statewide, regional bodies that run programs for the churches to execute on, right? So in my community, I'm an active member of United Church of Christ. Davia probably remembers that. And so they have a Northeast conference. They're in charge of several states in the Northeast, and they have this website that they all go to. They run webinars, blah, 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 blah. They reach hundreds of churches and pastors.
I would love that.
Baptists and Methodists do the same thing.
Breaking into is the churches. So any connections that you could have, we would love.
Yeah.
It's really blocking and tackling on so many different levels. There's no way that one organization can do all of it, which is why, well, first of all, it's a web. And what I think we can be doing is that we can be forming a focus of a web of campaigns that are trying to do the same thing. And that can make us, you know, exponentially more powerful. So creating that kind of a network of all of these ideas and all of these organizations, strategic partnerships, if you will, but maybe even a little bit more than that. There are a lot of things that we can do together. We are also looking for, given the fact that this is such an amazing group of people, celebrity endorsements. As you can imagine, those go very far in many communities. Athletes, star athletes, their endorsements. These, when you put them on TikTok, and when you put them on Instagram, and when you go viral with them, and maybe if you do PSAs, as I said, we already have some, these are very helpful as well. So on the ground, blocking and tackling, and then endorsements at different levels, these things, I think they meet together to give us virality. We could redefine that.
Thank you. Circling back quickly to Amy Baxter. Amy, I know you had you wanted to tag on some comments to Lisa's thoughts just now.
Yeah, just one quick thing. So the part of the reason why the vaccine hesitancy has become conflated with politics and with identity groups is because there are a very, very tiny number of very aggressive anti-vax Facebook in particular groups. And so like we got targeted. There's something called Shots Heard, which is a group that protects physicians whose practices get targeted when they put pro-vaccine and pro-immunization messages out. And so our website got targeted, and it's very insidious. So it's just something that as this comes out, you may need to have people who are scheduled to combat this on social media. We had to have somebody every hour taking off the things, because Facebook won't do it, but they'll have images of lemmings going over cliffs, or they'll have people crying or saying that killed someone, things that are way too benign to stop with filters. Well, they could if Facebook cared, but anyway, I think that as there is advocacy being done, just know that there is a very specific set of anti-vax groups, and that's one of the reasons why all of these people now say, oh, it's not vaccine hesitancy, I don't trust this or that. A lot of it's because it's conflated with very aggressive social media targeting practices.
Thanks, Amy. That's helpful.
And I gotta go. Nice to meet you guys.
Thank you very much.
After you.
I think with that, we might be at the end of our questions.
I think Linda Davey,
Linda Davey, go ahead and unmute yourself and your camera if you feel comfortable, and ask your question.
Okay, so I had a question, and I was in a meeting today where a lot of the people had vaccines, but somebody who was younger came in and had the only vaccine they'd been able to get was the Johnson & Johnson vaccine. And in fact, I was actually quite embarrassed. One of the people in the meeting kind of poo-pooed it as though and said he would never. I almost, if I could have kicked the guy under the table, I would have, but I did. I wasn't near enough to kick the guy, but there is this reaction, and I think it's both from several different groups about that one isn't as efficient, and yet it's going to be more available and it's only one shot. So it may be easier to get to some of these groups where it's harder for them to get it. And is there going to be a backlash because the poor are getting it, the people who are scheming and pushing got the other two? We have to be able to figure out how to deal with that and how to respond, because I actually know my husband told me he would go get the Johnson & Johnson if they let him, but he's because he's not quite old enough to get the other ones yet, or what was available in New York. But I think a lot of people don't feel that way.
Kathy, I'm going to give that one to you.
Yeah, absolutely. It's a really good question. all the vaccines have efficacy, and the Johnson & Johnson vaccine is not as efficacious as Pfizer and Moderna, but it still protects you from severe disease. And that's really our major concern, is we're trying to keep people out of the hospital, and we're trying to keep people from dying. And there's been a sort of difficult rollout with the Johnson & Johnson vaccines. The states are deciding, many states are deciding how they're going to use the Johnson & Johnson vaccine. You know, is it going to be sent to more rural areas where it's harder for people to come back and get a second shot? Is it going to be sent to younger people who may not feel that they want to come back for a second shot? So I think that that is a really good point. The Johnson & Johnson vaccine has some issues around it, but the most important thing that we need to get out is any of the vaccines can prevent you to a pretty good degree of certainty from dying. And that's what we really want. So no matter what they're going to offer you, you go get it.
And Linda, as my fellow board member for Girl Scouts of Greater New York, don't you think that we can talk about how we can get the Girl Scouts to help carry our message in many different ways? You have to unmute probably to respond. Okay.
Her plane might have taken off.
Right, but I'm sure she's in agreement. So that's one on my to-do list, because can you imagine, there are just saying 60 million living alumni of the Girl Scout movement in the US right now. 60 million, and there are at any point between 3 and 4 million girls and women who are involved with the Girl Scout movement.
Totally agree with you, Davey, on that one. And I'm also going to talk to my son, who's the CEO of a charter school in St. Louis, on how to work on groups there.
Fantastic.
Okay.
Thank you.
Thank you. All right. Yeah. So, if we think about the reach, if we just would to partner with them, right? I think we can try to make that happen.
Absolutely.
Okay, Trang, where are we?
I think we're in a good spot. Unless anyone else has any other questions, I think we're good to wrap up.
So, ladies and gentlemen, thank you so much for being here today. We had a great group of people. Some have fallen off, some haven't. If you want to stay around and chat, please feel free to do that. But I think we all know the issue. I think we might all have one part of the solution. That's certainly what we're trying to do. You've got a factor of indefatigability here amongst all of us who have worked so hard to launch this, to birth it, if you will. And we're looking for your ideas and your contacts and your partnership. And we even did, through the generosity of Nina Strike, we have gotten away. Getting a 501c3 registration is a very difficult thing. It's long, it's legal, it takes a lot of time, etc., which we're working on doing. But there are these magic ways to work with an umbrella organization that already has a 501c3, where they extend their umbrella for you. And Nina, who is the executive director, CEO, head of the Global Peace Film Festival, hope I'm not mangling that, Nina, and they do have a 501c3 status, and we're going to work with them, checking out the legality now, to extend that so that you can get tax-free donations. If you're not worried about the tax-free, send money now. And we're getting a donate button on the website. And Victor's working on that. So we'll have those means. We promise you. This is, to borrow Emily's list statement, early money is like yeast, it helps the dough rise. So we will use it for very good effect. Victor?
The button, it is already there.
The button. See, this is Victor. You start to say, could you possibly, and then he says, it's done. So there you go. Thank you. Thank you all so much for taking time out of your day. I know we're all zoomed out. And so thank you for that. Download the backdrops. They're pretty wonderful. You can use them. And please follow us on Facebook, on LinkedIn, on Instagram, on Twitter, on TikTok, and on every social media platform yet to be created. Thank you very much.
Thank you so much.
Thank you for both of you. Was wonderful.
Thank you.
Thank you. All right.
Thank
Bye-bye.
Thank you, Frank. Thank you, Amy. Thank you, everybody. Thank you.